So it's a pleasure to be here today to speak with all of you about DuchenneConnect. Let's see. So today I just wanted to provide an overview of the registry, and especially for those of you who are new to PPMD, and also just share some of the improvements we've done with the registry in this past year, talk about how your data is being used and what some of our plans are for the future and what you can do to be better prepared. So as Pat said, I don't work alone. We have a team with DuchenneConnect. I work closely with Ann Lucas. I don't know if Ann is in here anywhere. She might be out at our table. Ann Lucas joined us about 1.5 years ago, and she's also a genetic counselor, and she's really been a wonderful asset to our team. So the two of us are the DuchenneConnect coordinators. So when you call the registry or you email the coordinator at DuchenneConnect.org, you get one of the Anns. We also work closely with Holly PA. She is now the principal investigator for our PPMD project, and I'll be talking more about that in a few minutes. And also we work with Patient Crossroads. Patient Crossroads is the company that developed our registry platform. So we've worked with them from the beginning, and we continue to work with them as they make upgrades to this platform. And I do want to point out that the registry platform that was created for DuchenneConnect is actually now been used by hundreds of disease registries, and DuchenneConnect is really considered a model for rare disease registries, which is great. So just to review, for those of you who are not familiar with DuchenneConnect, we are an online registry and resource for individuals with either Duchenne or Becker muscular dystrophy, as well as carrier females. And we have over 3,000 members currently, and it is an international registry. But although 2/3 of our patients are from the United States, we do have over 100 countries represented in the registry, which is really remarkable. And we're also a member of the Treat NMD Neuromuscular Alliance. So that is, they kind of oversee the global Duchenne and Becker registry. So when you register in DuchenneConnect, certain of your data points are actually shared with the global registry. And we're also a member of PPMD, which is the National Patient-Centered Clinical Research Network. And again, I'll talk more about that in a minute. So just some brief history quickly. DuchenneConnect was created by PPMD back in 2007, so we actually have over 7 years' worth of longitudinal data. And we were developed with the direction of an advisory board. We currently have 40 clinical advisors. These are clinicians who are experts in the field of Duchenne and Becker. We also have researchers from both academia and industry. And then, of course, we have several individuals with Duchenne as well as caregivers on the advisory board. So the goal of the registry when it was created, and really the goal still is, to educate and connect the Duchenne and Becker community, including not only the individuals with Duchenne and Becker, but also their caregivers, their healthcare providers, and their researchers. So what we do, we're really not just a registry, we're also a resource for the community. We do a lot of education. We send a lot of newsletters and email announcements. We have written the fact sheets that are in your program. We also assist with the webinar series, and we actually have a new Facebook page. We launched it earlier this year, so please follow us on Facebook. It's a separate Facebook page from the PPMD page, so please like us and follow us. We do, of course, a lot of recruitment. In 2014, we recruited for 7 clinical trials and 12 research studies. We do genetic testing. We, about 1.5 years ago, launched a new genetic testing program called Decode Duchenne, and this provides free genetic testing to patients who've not been able to access testing due to financial barriers. So if there's anyone out there who needs testing or someone in your family needs testing, please come see us at our table out in the lobby. And we've actually tested over 100 patients so far with this program. And of course, we also provide data. In 2014, we provided feasibility data for clinical trial planning to 8 different institutions, and I think that number will actually be increasing a lot this year, which is exciting. So we're really prepared to help not only patients and their caregivers, but also the research community as well. So this is just a screenshot from our homepage I wanted to show for those of you who are not registered yet. Our website is now entirely mobile friendly, so we're thrilled about that. So registering and updating your account will be even easier than ever because you can do it from any device. And you can see the Decode Duchenne program is listed there on the website, and we have a landing page on our registry about it. I did want to point out that Sarepta Therapeutics provided the funding for this program, and Emory Genetics Laboratory has been doing all the testing. So I really just want to say thank you to Sarepta and Emory for all of their support for this program. And we do plan on continuing this program. We're actually currently securing funding from several other industry sponsors, so we're really excited that we'll be able to continue this because it's been so beneficial to patients and families and also healthcare providers, and it's also enabled us to really reach some of the underserved patients in our community. So one of the big changes we made with the registry this year was a new consent form, which I know sounds dreadfully boring, but it's actually a very important document, and it went through a lot of revisions. We've always had a consent, but we revised it with the help of all of our advisors and also some of you in the community. So our new consent explains the purpose of the registry, who can join, how your data will be used, how we protect your privacy, and also the benefits and risks of participating. And everyone actually must update their consent. So even if you're already an existing DuchenneConnect member, when you go to log into your account, you're going to be taken directly to our new consent, and you must update that consent before you can access the rest of your account. So please come see us. We're at the DuchenneConnect table right across from the registration table out in the lobby, and we're happy to help you with that. We can help you update your consent and also help with some of your medical history surveys. And everyone who comes and sees us will get a lovely DuchenneConnect cup that you can take home. So, yay. This is another screenshot of our profile page. So once you are consented and you get into your profile page, this is what you see. In the red box, you'll see the medical history surveys that you need to complete, and I'll talk more about those in a second. You can also upload test results. So I really encourage everyone, please send us your genetic test report. We need that. You can upload it, or you can email it to us, fax it to us. You can even send it through snail mail if you need to. You can add family members from this page. So if you have a second child affected, or if you're a carrier, you can create an account for yourself within this main account. That way all of your family accounts are linked. You can also add your healthcare providers here, and this is where it's really important, especially for the certified Duchenne care centers. We'd like to kind of keep track of who's being seen where and what does their care look like, and that's our way of doing that. So please enter your healthcare providers as well. You can also track your height and weight from this page if you'd like to do that. And another really new and exciting feature for us is the invitations. You can actually invite others to join from your profile page. If you just click on that invite others and enter in an email address of a friend or family member who's affected with Duchenne and Becker, then they'll be sent an email about what the registry is and how to join. And we've actually just recently launched an Invite 5 campaign where we're asking all registrants to try to find 5 other people that they can invite just to help spread the word about the registry. And so that would be easy to do through this feature. So I want to get back to the medical history surveys, because really the biggest change we've made to the registry this year is we took our old medical profile survey, which was a really long medical history survey, and it was quite cumbersome, I think, for a lot of you, for everyone. And so we've taken this survey and split it into several smaller surveys that are much more short and user-friendly, and we've already launched several of those, including the muscle function, corticosteroid, and the heart module, and we're going to be launching several more as the year goes on. So we really encourage you, actually we beg you, please, please, please log in and take these new surveys. Your data is really important, and the success of the registry really depends on each of you. So the surveys, like I said, are short. They should each take 10 minutes or less to complete, and they're easy. And every month we are actually doing a raffle for an iPad. So every month that you log in and complete one of our new surveys, you're entered into a raffle for an iPad, which is exciting. And these are just a few of our recent iPad winners. I just had to show their pictures because they're so cute. So this could be you. Complete a survey and you could win an iPad. And we also are giving away Amazon.com gift cards every month as well. So you have a chance of also winning a gift card. Okay. So a lot of you probably are wondering how your data is being used, and I just wanted to point out that we've actually had 3 publications in the past year. In January, there was an article in the Human Mutation Journal that summarized more than 7,000 mutations in the DMD gene that were reported by the DuchenneConnect Global Registry. And again, so when you register in DuchenneConnect, certain key data points are shared with this global registry. So, and again, I want to point out, when we share your data, we're not sharing your name and other personal information such as that. It's all de-identified data that we're sharing with DuchenneMD and with everyone else. So again, it's just so important to keep your account up to date and also to submit a copy of your genetic test report. In last October, there was an article in PLOS Currents. PLOS is the Public Library of Science. So PLOS Currents Muscular Dystrophy published an article by Dr. Stan Nelson and his team at UCLA, and they were looking at which medications and supplements may be prolonging ambulation in Duchenne. And they found that Duchenne self-report data actually confirms natural history data, and it can be used to assess therapeutic benefits. And that was really a huge thing, because it's basically saying that for some research, registry data can be used in place of clinical trials, which would really save everyone a lot of time and a lot of money. So I think probably many of you in this audience were involved in the GSK Burden of Illness study that took place 2 or 3 years ago now, but the publication was actually last summer in Neurology. So I just want to thank all of you who participated in that as well. And just to let you know, all this data is on our website. We have a How Your Data is Being Used page on the website that you can refer to find out, who's using your data and what publications have come about. So probably the most exciting development with the registry recently has been our funding award from PCORI. PCORI is the Patient-Centered Outcomes Research Institute, and we're now one of 29 networks participating in PCORNet. And PCORNet is the National Patient-Centered Clinical Research Network. And really, PCORNet is kind of a network of networks, so it's several networks joining together. There are 11 clinical data research networks, or CDRNs. These are like larger hospital networks. And then there's 18 smaller patient-powered research networks, or PPRNs. And those are like the patient registries like DuchenneConnect. So we're one of the PPRNs that's part of PCORNet. And the goal of PCORNet is to create a large national database of patients with both common and rare diseases in order to conduct research both more quickly and more cost-effectively. So for our own PCORNet project, some of our goals, well, first of all, we're working with Patient Crossroads, our IT vendor, but we're also working with Geisinger Health System and UCLA. And our main goals for our project have been to improve data collection, and we're going about that in many ways, but one of the most exciting developments is that we're working with Geisinger and Patient Crossroads to pilot integration of electronic health record data into the registry. So if there's actually anyone here from Pennsylvania and who's been seen at a Geisinger facility, please come see us at the DuchenneConnect table, because we'd like to talk with you about that. We're, of course, hoping to reduce registrant burden. I feel like we've done that somewhat by making the website mobile friendly and also making the surveys shorter and more user friendly. And we're also going to have an app that's coming out later this year that'll be released soon, so I think everyone will enjoy that. We also want to increase the number of our registrants, which is why we've launched that Invite 5 campaign, just trying to spread the word and get more people in the registry, and also trying to increase the diversity of registrants. And we're working with several neuromuscular clinics around the country, providing them with tablets so that patients who may not have access to a computer or who may need help registering, they can do that in clinic when there's downtime in clinic, because everyone knows there's a lot of time when you're just kind of sitting around in clinic. So another goal that we have, and what's actually really at the heart of PCORI, being that it's the Patient-Centered Outcomes Research Institute, is we really want to empower members, registrants, all of you, to set the research agenda. And we've gone about that a couple ways so far. We've had 2 closed online forums to discuss different topics, different research topics that would be of most interest to you. We've also done some one-on-one interviews. And one of the topics that came up was GI-GU concerns. And some of the information that came from the online forum actually helped informing our new GI-GU survey, which we launched on the registry back in March. And the exciting news is that the researcher who's helped us with that, Dr. Kent Williams from Nationwide Children's Hospital, he's actually presenting the results from that survey on Saturday afternoon here at the conference. So that'll be interesting to hear. And then, of course, the last goal is just being able to improve our research capacity and speed. And I think, well, we're currently in phase 1 of this PCORNet project, and we've applied for funding for phase 2. And if we get funding, we will continue working on all of these projects and also continue to expand our collaborations. And all of those should help to speed research along. I do want to thank our PCORNet Family Leadership Committee. This is a group of volunteers who have worked with us throughout the year and continue to work with us, and they've really provided a lot of valuable insight. So I just want to say thank you to them, Jason and Adele, Tom, Brian, Benjamin, Zach and Margie, Gregory, Jacqueline, Tejas. Thank you all so much. It's really been a pleasure working with all of you, and they've added so much to this project. And again, I'm just going to plug the clinical trial fact sheets that are in your program here. They are also housed on our website, so they're easy to access. And these are family-friendly summaries of clinical trials that are actively recruiting or in the pipeline and soon to be recruiting. And this is really a great effort to put all of these together, so I hope all of you use them and share them. And they are all approved by the researcher, the respective research behind them, so it's a great resource to use. So finally, in conclusion, I just want to say there's really never been a better time to be involved in DuchenneConnect. Please, if you're not registered, please register. And if you already are registered, please update your account. Come see the Anns at the table outside. We'll help you get everything updated, including your consent. And also, please spread the word about DuchenneConnect to other family members and friends who are affected by muscular dystrophy. Because obviously the more people we have in the registry, the stronger this resource will be. And really being a member of DuchenneConnect will not only help you be better prepared, but it'll also help the entire Duchenne community to find treatments and hopefully a cure even faster. So please register. Thank you.